Welcome everyone to NCUI's COVID success stories, the HR challenge enforcement of COVID-19 vaccine mandates, retention, and recruitment. This is the last of 3 sessions in the NCUI community of learning COVID success stories. In this session, presenters Angela Young Gethfrey of Native Health and Roland Acupido of the Indian Health Center of Santa Clara Valley will present HR challenges they have faced because of the pandemic and solutions they have used. I'd like to introduce our team from TARC. My name is Mark Clark, and I am a Technical Assistance Manager with the Technical Assistance and Research Center, also known as TARC, at NCUI. Joining me from NCUI are Sabu Kayunjian, the Technical Assistance Associate, Molly Siegel, also a Technical Assistance Associate, Mindy Pretty is the Associate Director of Communications, and Sean Bitsui is our Communications Associate. We're honored to have you all here today, and we kindly ask that you place your name, organization, tribal affiliation, and title into the chat box as you enter. In addition, we welcome any feedback you would like to provide about your webinar experience in our survey. A link to the survey is pasted in the chat box for your use below. Next slide, please. We invite you to complete the survey for your chance to win a Democracy is Indigenous swag and a free pass to our 2022 annual conference, No More Broken Promises, A Path to Health Equity in Indian Country. Again, we welcome your feedback through the survey. And if you complete all 3 surveys in our 3-session series, your name will be entered into that raffle for the opportunity to win the free pass. So we hope you'll participate in that incentive opportunity. Remember, all slides will be posted and shared after this presentation. So we'll look forward to sharing those resources as we go on with our discussion. Next slide, please. For those of you who are unfamiliar with NCUI, here's a little background. The National Council of Urban Indian Health, also known as NCUI, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUI is the only national organization of the 41 Title V urban Indian organizations, or UIOs, under the Indian Health Service mentioned in the Indian Healthcare Improvement Act, or ICHIA. NCUI strives to improve the health of the over 70% of AIAN population that lives in urban areas and is supported by quality, accessible healthcare centers. Next slide, please. As a reminder, this session is being recorded. All mics have been muted upon entry, and we always encourage participation and engagement in these sorts of events. So we invite you to turn on your camera and post questions and comments in the chat box throughout the session. There will be opportunities to participate in the Q&A and discussion throughout the agenda today. Also, please note the QR code on the bottom of this slide and other slides that you'll see in the presentation. If you scan it with your phone or tablet, you'll be taken to our session feedback survey, where you can leave your comments on what you liked most and how we can improve these sessions. Your participation and your feedback is always greatly appreciated and genuinely valued. Again, the QR code can be found on the bottom of slides throughout this presentation. Next slide, please. Again, our double raffle and the incentive, we appreciate your feedback throughout the session. We're asking that you complete your survey session. And remember that if you have participated in all 3 COVID success stories community of learning sessions and completed your surveys and attended throughout, then your name can be entered for a chance to win the free pass to our 2022 annual conference. We're also offering a chance to win a Democracy is Indigenous t-shirt and mug. So there's plenty of incentives. We hope you'll stay through to enjoy the entire session, as well as earn fabulous gifts and prizes. Next slide, please. This slide features, this slide features some information on how to use Zoom. For those that are familiar with Zoom, you will have seen this already. At the bottom of your screen, you can find the chat box feature, and you can click on that to enter the chat. Please enter your comments and suggestions in the chat box. Next slide, please. Throughout this session, you feel free to use your emojis and icons to express yourself during the presentation. You simply click on the smiley face in the chat box window, and the emojis that you can select from show up in a drop-down menu. Next slide, please. As shown on the agenda, we'll begin our presentation at about 1:05 p.m., followed by the Q&A session approximately at 1:50 p.m. We will end on our evaluation and discuss upcoming events and adjourn promptly at 2 p.m. Eastern Standard Time. We want to be respectful of your time today. Next slide, please. I'd like to introduce our presenters. Angela Young Gethfrey is the Director of Administrative Services at Native Health in Phoenix, Arizona. Angela joined Native Health in 2019, and before joining Native Health, Angela dedicated herself for 17 years to the Urban Intertribal Center of Texas. In her Director of Administrative Services role, she leads the human resources, IT, property management, quality control, safety, facilities, and fleet departments. Angela is certified as a nonprofit management executive with over 30 years of experience in nonprofit management. She's an active member of the Society for Human Resource Management. In 2018, Angela was featured in the Indigenous Post magazine as a top leader in Indian country. She is an enrolled tribal citizen of the Choctaw Nation of Oklahoma. Let's please welcome her with your heart emojis shown in the chat box. Next slide, please. Our second presenter, Roland Acupido. Roland has been working with the Indian Health Center of Santa Clara Valley since 2018. He has over 25 years of experience in human resources. His previous experience includes work as a Chief Human Resources Officer, as a Human Resource Director, and a Compliance Officer at other healthcare centers and facilities throughout California. His work focuses on team building, and he leads a team of 4 staff. He earned his undergraduate degree at San Diego State University and has a Bachelor of Science in Business Administration from San Francisco State University. Let's please welcome Roland with a heart emoji in the chat box. And with our next slide, the presentation will begin. Thank you, everyone.
Hi, everyone. So today, it's good to be here, and we're going to be discussing COVID success stories, the HR challenge, enforcement of COVID-19 vaccine mandates, retention, and recruitment. Next slide. Angela will do the challenges.
Yes, first of all, thank you for joining today's very informative call, and thank you, NCUI team, for organizing this. And we're going to start off with challenges. And Roland, next slide. So Roland's going to lead off with introducing some of the challenges that he faced at his organization.
Yes, so here in California, we've had a lot of challenges with the vaccine mandates. Public health, we're in the county of Santa Clara, so public health came out with a lot of health orders that we had to follow regarding the vaccine mandates. And the slide on the right, it's just an example of one of the vaccine mandates we had to follow. And what this required us to do was to track every staff all of our staff are vaccinated. So we had to track every booster shot that was put out for COVID-19. And so the problem is just tracking, the tracking piece of it. So that was a challenge for us. In the second slide, the 2022 COVID-19 supplemental paid sick leave. As you know, we had a federal sick leave that was put out and then it went away. And then in January, California decided to put out the California supplemental sick leave, which was exactly the same as the federal. It gives 80 hours of COVID-19 related sick time if you are sick with COVID-19 or you have to take care of someone in your household who has COVID-19. So 80 hours again was given to staff, which creates the challenge for us was that when staff take time off for COVID-19, the challenge is trying to find someone to fill that time slot. I mean, typically it was like 10 days off, so we had to find staff that we had to find temporary staff to fill the time slot. And when it's compounded by if you have 4 or 5 staff taking a supplemental sick leave, then we have to find staff to cover that. And the other challenge that we had is with our turnover rate. This slide here shows our turnover rate, and the little black box up top breaks it down by quarter. So if you look at the quarter 4, which is the top, our turnover rate was 9.47%. As you can see, it starts to increase. It's a high percentage July, September, October, December, it went down due to the holiday, and then it started creeping up again in January, March. This is due to the great resignation that's happening right now. We have a lot of staff that, not a lot of staff, we do have staff that are leaving the agency for better opportunities, which again, creates a challenge for us to find out who we can fill these positions with. So the recruitment is at this time is very hard for us. Next slide. Angela.
Thank you, Roland. So like Roland's program, Native Health in Phoenix, Arizona had similar problems. And what we had to deal with in the beginning, it was a challenge to stay up to date with the latest health guidance and understand and implement the COVID-19 related federal and state laws and regulations. And then we had our state. And so you had that mixture and it created a huge challenge. COVID-19 screenings in the workplace, developing those policies and procedures, developing safety protocols in the workplace, keeping up with employees, making sure that they remain safe during this high COVID exposure time. I know that we all can relate. It is a lot of work to keep up with the rapid changes by the Occupational Safety and Health Administration, which is OSHA, the CDC requirements, CMS requirements. The list is long. So Native Health is very fortunate during this process that 99% of our company is fully vaccinated. So that is a positive in this challenge. I've included some references that will be available to you after this presentation, which is OSHA guidelines, CDC, and the CMS guidelines. Next slide, please. At this time, we'll have some polling questions. And the polling questions is, does your UIO face similar challenges? And if so, provide a thumbs up or a down emoji in the chat box. Next slide, please.
So we want to ask you, what makes this challenge for your UIO? Retention recruitment challenge or enforcement of COVID-19 vaccine mandates?
Next slide, please.
There's some comments that came in. Johnny Delgado from BAHP had mentioned saying that all of the above for all of those things that was mentioned, from retention to recruitment. And Carrie Hawk Lassard from Native American Lifelines just put another comment saying mostly retention, recruitment, and everyone wants to work remote and never come into the office.
Right. Well, hello, Carrie. Yes, we can relate to that as well. We have created some workaround in regards to that retention and recruitment at Native Health. However, it still poses a challenge. So we continue to work on that, and we hope that we all can walk away with some best practices today and sharing of stories. Thank you again, Carrie, for sharing your input. Next slide, please. At this time, we're going to share some solutions. Next slide. Roland, it's all yours.
So some of the solutions that we came up with were unique, but as you know, UIOs have limited resources. So we had to work with the budget on some of these, and we also had to we couldn't offer like what other nonprofits or other for-profits offer. So one of the solutions that we had was to offer a sign-on relocation bonus for specific positions. And those specific positions are just provider only. As you know, provider recruitment is very, very tough right now. So we couldn't offer it to every single position we had. So we had to be very selective on what positions we wanted it to offer. And it seems to be working just with providers for now, but we do have a shortage of nurses and medical assistants, line staff too. And we just don't offer the sign-on relocation bonus for them. The next thing we did, we updated our telecommuting policy. We took a look at the existing policy, and since everyone started to work from home during the past 2 years, we updated the policy. It's a policy that you have to actually read and then sign off on. So we have a written document with a signature on it. So that helps. And then we update it. I think it's every 6 months. We ask the staff if they're still telecommuting, or the manager if their staff is still telecommuting. So we updated our telecommuting policy. We also completed a salary survey to ensure salaries are competitive. This was a major one for us because it's very competitive here in Silicon Valley, not only for for-profits, for not-for-profit, and also amongst the health industry. So salary survey we did, it was very competitive, and we went with the, we tried to hit it at the 75% percentile, but it's closer to like the 50% percentile. So a salary survey just ensured us that we're competitive with other agencies out there. Next one we did, we offered flexible schedules. We have some providers are working Monday through Thursday. We try to work it around their schedule if possible. We try to accommodate them on their schedules when it's possible, but we just offered flexible schedules for staff. And another one we did, we emphasized our benefits package.
At the tone, please record your message. When you have finished recording, you may hang up or press 1 for more options.
IHC offers a very competitive benefits package. We pay about 90% of the premiums for all staff that enroll in our benefits. And that also includes dependents too. So you don't see that many corporations or companies actually paying for dependents on a medical plan. So that actually makes us a little bit different than other agencies here. So all these things we try to do, we try to come up with different solutions all the time. But again, like I said, we have very limited resources. So we have to be very creative on what we choose and pick. Next slide.
Thank you, Roland. You absolutely have a robust insurance program, and you're right. Not a lot of organizations will provide dependent insurance coverage. That's amazing.
Yeah.
So for Native Health, some of the challenges that we've experienced is similar to what Roland and his organization has experienced. We've had challenges attracting and retaining talent, and which is a top priority for Native Health. However, it has been a challenge. One of the challenges that we have is recruiting certified medical assistants. Our provider side, we've been pretty stable and really lucky that we have been stable in that area. Front office employees has been a challenge as well to retain those individuals. Some of the things to improve the recruitment retention process that we have implemented are the following. For certified medical assistant, we offer a sign-on bonus of $500. We've implemented an employee referral program, meaning an employee referral program. The strategy is to encourage Native Health employees to refer qualified candidates to apply for the certified medical assistant positions. The employee will receive a referral bonus of $300 after the new hire completes their 90-day probation period. We're partnering with the local schools that specialize in certified medical assistance training. And then we are offering a tuition reimbursement for continuing education. We've created an employee and health and wellness program offering fun monthly activities and incentives. Also, we're using social media for recruitment as well on a continuous basis. Next slide, please.
Okay, enforcement of COVID-19 vaccine mandate solutions. As you saw with that health order, we need to develop a tracking system. And there is no set tracking system out there for us to actually maintain and to start up. So we had to develop our own tracking system and make sure we were tracking staff. Because when public health asks us for the information or for data, or from any other place asks us for data, we had to show proof of the data that we are tracking. So we had to develop our own tracking system, basically on a spreadsheet. We do use MedTrainer. I'm not sure if you guys are familiar with that. And they have a component on there that we actually developed for a tracking system. But just recently, ADP just came out with a vaccine tracking system for staff, which was a major help for us because it enables staff to upload their vaccine, proof of vaccine, onto the system, and it provides great reports. So the ADP actually was a major help for us. We also had to hire temporary workers to fill in the gaps. And we actually had to involve more temporary staffing agencies. Right now, I have about 4 or 5 temporary staffing agencies that I work with that provide the temporary staff for us. And again, when you go to those staffing agencies, they tell us the same story that you tell everyone else. Oh, we have so many people asking us for the same positions, for the same jobs and all that. So again, there's a lot of competition here that creates these, that creates a challenge for us. But these two systems actually have helped us solve some of the issues that we've had with enforcing COVID-19 vaccine mandates.
Great.
Next slide.
Thank you, Roland. So some of the things that we have done at Native Health in Phoenix to implement the vaccine mandate, we formed an HR committee to review the OSHA, CDC, and CMS and the state COVID-19 guidelines. Then we also developed and implemented policies and procedures ensuring all staff are vaccinated for COVID-19, including tracking staff vaccines, documenting exemptions, and masking requirements. We established clear lines of communication, of all levels of staff positions in the organization. We offer COVID-19 vaccine incentives and to encourage individuals, employees to get their vaccines. Also, we offered reasonable accommodations for non-vaccinated employees with medical conditions and sincerely held religious beliefs. The non-vaccinated employee must wear a mask and is subject to regular COVID-19 testing. Vaccination is a condition of employment at Native Health. Medical conditions and sincerely held religious beliefs are the only exemptions. And then new employees must be fully vaccinated before the first day of work or a qualified exemption. Next slide, please. We have polling questions. Do you and your UIO have similar solutions? Please insert a thumbs up or down emoji in the chat box. Don't be shy. Let me see your thumbs. Right now we have 2 thumbs up, what I can see. Yeah, only temp staffing from Ruby. Rosanna, thank you. So if anyone has a thumbs down, we'd definitely like to hear from you. Karen, thank you. Thumbs up. Thank you for your input and your thumbs up. Next slide, please.
So what makes a good solution? Retention or enforcement of COVID-19 vaccine mandates?
So some of the resources that we have available for you, and I don't know, did we skip a slide?
We did have one question in the chat. It's what sort of incentives do you provide? From Ruby Guzman. Thank you so much for that question. So maybe you guys can talk more about what incentives you guys have.
We actually at Native Health, anyone that received the booster, any of our employees received a $300 incentive. That was a cash payment as when they showed proof that they received their vaccine. And we also have an employee's health nurse that keeps track of all the vaccines for employees. And so with our health and wellness program, we offered like these really great packets of like hand sanitizers, stress relievers, like candles, any kind of scents that we can, take that stress away from the employee. So we actually have a team of employees that come up with different ideas to put these little fun packets together for employees, and it's anything that you can do to provide that incentive to make your employee feel like they're valued is a good incentive.
What incentive did you provide, Roland?
We already provide incentives for staff. I think the direction is that it doesn't really work for us. What we do though is that similar to Angela, we just value the employee. I mean, we tell managers to talk to their employees and encourage them to keep up to date with the booster. Like every health agency here is that every staff has to be vaccinated, which is great. We do have a number of staff that came in before that mandate actually happened. There's like 9 staff that are unvaccinated, but we require them to be tested once a week. And the other vaccinated staff, they have to be tested twice a month. And we've been having good results. I mean, everybody's been following the testing guidelines. I haven't had to talk to anyone about not being vaccinated, not being boosted, or not being being tested on a regular basis. So it's been pretty good so far.
You know, another thing that we did at Native Health, as far as thinking about the employees' health and wellness, is that we partnered with our insurance broker and also Aetna, our Aetna broker, and they provided a $15,000 grant to go towards our employees' health and wellness program. So we were able to initiate and establish like a workout session, also focusing on the mental health of the employee. And when they would sign up for these activities, they would get a one-time like a incentive, a sign-on like bonus to participate in these health and wellness activities for employees. And that was huge. We had, I want to say 96% of our employees that participated and they signed up. And thanks to the partnership of our health insurance plan through the broker and their assistance. And the thing is, you never know what you can get until you ask. And if they say no, wait a few minutes and ask again. Eventually you'll get something.
Do you offer an incentive for employee referrals, Angela?
Yes. So like in the referral part is if you refer, like right now what we have going on, because we have a shortage for medical assistants, if you have a solid candidate that you sent to Native Health and they were selected and they stayed on the job for 90 days, you get a $300 that you can go and do anything with, Roland. Do you want to take me out to come to Phoenix, Arizona and take me out to dinner? That's a good use of your $300.
That's good. We offer a referral program too, but it's mostly geared toward the providers because we have a trouble, filling that position. So ours is $1,000, but of course HR can't participate. So
Right.
So that's what it is.
That's great. I wonder, I would like to see a show of thumbs if the people participating today, do they have some type of incentive recruitment plan at their organization? Does anyone have experience with hazard pay and workers' compensation for COVID exposure? That is a hot topic, and that would be interesting to hear what other organizations have experienced. At Native Health, we've been really fortunate. Again, like I say, 99% of our employees are vaccinated, and the majority of them also have their booster. That doesn't mean that we didn't have any employees that end up getting COVID, but what ended up happening, their symptoms were really mild. So we haven't, knock on wood, haven't had any significant impact due to COVID-19 to our employees. But again, it would be interesting to hear what are some of the challenges that you guys have faced out in your organizations. Roland, I don't know if you have a story that you can share with our audience currently that's on this call of any of your experiences maybe that you faced with your employees having some complications related to COVID-19 and you've had to use workman's comp and so on.
We haven't had that experience here about employees going out on with complications due to COVID-19 on a workers' comp case. I mean, we have plenty of workers' comp cases, needle sticks, all that, but
right.
we haven't had anything related to COVID-19, thank God, yet. So And if we do, first thing I do will be talk to an attorney.
Yeah, definitely. So curious to hear about some examples of flexibility schedules. Whoop, I didn't get all of that. Oh, here we go. So curious to hear about some examples of flexibility schedules that were implemented, hybrid models, remote, in-person, etc. Okay, well, moving on. So that's a great segue into our next segment. Roland, you want to take the lead?
Let's see, on this question here.
I guess
No.
what, go ahead. It
Our,
was a question.
yeah, our flexible schedules are basically if we we talk to staff and a provider wants only work 4 days and we say yes, if we can fit the spacing and we can accommodate them, then that's what we do. We do have some hybrid schedules where administration's working from home and they work 2 to 3 days in the office, and that's it. If they check out a laptop, they have to be on the system so people can email them or call them at any time. So we keep track of that. But we have about 267 staff, so it's actually been working pretty well for us, these hybrid schedules, and remotely on some positions. And then some positions, like our counseling department, most of them work from home now. They're in the office, I think, once a week. There's meetings, but most of the time they're working from home, and it seems to be working.
Yeah, I agree. Likewise, at Native Health, early on when the pandemic hit, we created an incident command center, and I happened to be one of the leaders. And it was a great experience. I'm so much more knowledgeable. But we had a lot of our program directors and especially IT that was involved. And when we were looking at, because in the beginning, we really didn't know what we were facing. But as the pandemic increased and the seriousness of the illness and the death rate was going up, we realized that we need to shut down pretty much the in-office type of services. And we offered telehealth. Also, we did a huge purchase of laptops. We looked at employees who could work remotely. We set up their laptops. We got all the tools and devices that they need in order to work remotely. We made sure that their home office space was conducive to privacy, because you have to make sure that you follow the HIPAA guidelines when you work remotely. There was a lot of involvement as far as planning to work remotely. And now that we're there, and like Carrie was saying, there's a lot of employees, they like working remotely and they really don't want to come back to the office. So we have experienced that. And so we look at the total workforce, and we have almost 200 employees at Native Health. We identified who absolutely can work remotely the majority of the time, who can have a flexibility in their schedule, the hybrid schedule. And so where we're at today is also looking at space planning. You've probably heard of hotel spacing now, which is a new somewhat terminology I'm getting used to. And what that is if you have hybrid people that have a hybrid schedule, they can come into the office periodically and they share the workspace. So we created, and what we're in the process of doing is creating like working the docking stations. So when they bring their laptop with them, they'll never have to like switch computers or anything. All their information is right there. So that the list is really long. We're looking at focusing the end of the pandemic, and coming up with plans. How can we still be unified and keep people happy and keep the remote schedules for some people, and then the other folks that have to come back into the office, which creates somewhat an HR nightmare, because we want a happy workforce. And yes, definitely we will experience some turnover because some folks that will be required to come back to have face-to-face interaction with your patients and clients would like that schedule, and they may end up leaving the organization. So that's where it creates a little work for HR to continue that recruitment and retention process. Yeah, Carrie, they do get super mad, and it does involve HR to resolve the matter. And sometimes, you know, we don't really have any choice but to give them an option that based on their position description, they would have to be at work. This day and time we live in now, we don't have a cookie cutter workforce. It's really the dynamics of how we run our organizations is quite different. And depending on the state that you live in, also creates that division of how you handle your workforce. In Arizona, we have state employment laws that we have to follow. You have your federal employment laws we have to follow. And so, yeah, it has been somewhat an HR challenge, but it's been a very, what you would call knowledgeable experience. And in our lifetime, not one person has ever experienced a pandemic like this where it impacted the total operation and workforce of all organizations, no matter the size, where you live, or anything. And so having this dialogue today has really been beneficial, and please share your stories with us, because that's what we're here for today, is to share some best practices. Again, real quickly, resources that we have included here is the CMS healthcare staff vaccination requirements. This will not pertain to all the urban programs. This really pertains to health programs that participate in the Medicare and Medicaid reimbursement programs. And so what they have, an interim rule that they have published, is that all employees must be vaccinated unless they fall in those two areas of exemption, which is the religion exemption and the medical exemption. Again, they have to have their first dose and second dose, and each state has a specific guideline of when this occurs. So by now, here it is, May the 10th, all your employees should have at least their first and second dose of vaccine. And if they do not, then hopefully they fall within those two exemption categories. So the other is the HR guidance, and it's a frequently asked questions. I believe in adopting best practices, sharing stories with other organizations. And I've included the Arizona Department of Administration. They created an amazing HR guide, and it includes those frequently asked questions. Feel free to use that. It's not copyrighted. It does have some really good tools. And so the next one is the National Association of Community Health Centers. Again, this goes back into relations to the mandate for the vaccine and other frequently asked questions. And there's some answers as well. Roland, do you have anything else that you would like to add to additional resources that we may not have added here?
Yeah, for my resources, we have not an on-site attorney, but an attorney that we use to pass everything by. I also Google a lot. I mean, sometimes if a policy comes up or you have to write a policy, just Googling it helps out a lot too. And then public health. I mean, the public health, Santa Clara Public Health website offers a ton of information for us. So check your public health websites, because they're always a good reference point to see, to get started, basically.
I was just gonna say before we move on, there was a question that someone had asked about, have you found your organization to save dollars on facility costs with employees working remotely? And to either Angela or Roland, that question.
Yeah, I saw that question. You know, we haven't really saved dollars, but what we did, it created more space for us. With people working from home, but we had to move things around or maybe have another exam room. It did create a little bit more space in admin and everywhere else. So, but as far as saving dollars, not yet.
As far as Native Health, Roland, we experienced the same situation. We haven't really seen a significant savings as far as operational cost for each one of our organizations. We have 3 in Native Health. And again, like your organization, it has freed up some additional office space. And that's where right now where we're working with the program directors to identify who can actually work remotely, have a hybrid schedule, and come into the office occasionally. So that would be shared space, and it would open up more space to actually have provider one-on-one sessions with patients and clients that are coming in for their appointments.
That's helpful information, particularly about the hybrid space. Given other changes with people on leave, scheduled and otherwise, there was a question in the chat that asked if there are problems with changes in leave status policies that are attributable to quarantine or isolation of staff due to COVID or COVID exposure or other kinds of related issues with COVID. So I think that's more about what happens when persons are quarantined and how that might influence leave policies. Any experience with that?
Yeah, so I think now I'm a policy expert in writing policies. Definitely, to keep on the safe side, you need to have a policy to guide you through this process. And it's very important, especially for your program managers that supervise employees as well, to follow those guidelines in regarding when an employee needs to be out that's COVID related illness. And sometimes it's not just the employee that may be ill during this process. It could be the family that they have to leave work for to take care of the family member that's ill. So we at Native Health have been mindful and created policies to support the employee when they do need to take leave. And we've also created a burial assistance. And that's sad to say, but some family members in our communities have lost family members due to COVID, and it's impacted their finances extremely. And for an example, it's not an employee, but we had a board member early on in the pandemic lost her husband and son within a week and a half. And burial averages about $5,000 per person, and that's minimum. I mean, it's very expensive. So we're very mindful of those situations that our employees face. And so again, having a good, solid policy that will address all of those things that we've never had to really face in our lifetime of managing HR. And I don't know, Mark, if that answered the question. I might have been off on a tangent.
No, but I know I appreciate your observation. I think that was an interesting tangent. I know the resource that was shown and the link that was shared on the COVID-19 vaccination requirements, there's a slide that offers a little more opportunity for detail. I don't know, Angela, if you shared what you wanted to on that particular
Yeah, so this particular slide that we're showing right now is just an additional resource that you have available to share with your staff. Again, keep in mind, this is UIOs, Urban Indian Health Programs that actually have healthcare facilities that participate in the Medicaid and Medicare program. They do have an a final rule that employees must be vaccinated. If they're not vaccinated, then again, they must follow those two exemption rules, which is the religion exemption and the medical exemption. I know that this has created probably a nightmare for some of our programs because some employees may not want to be vaccinated. And so that's where it leads into like that retention problems, you know, that are challenges that we have. But again, this poster or flyer that's displayed may not pertain to your program. Look at it, review it. Again, we have the additional resources to CMSs in your link that gives you more guidance that's actually pertaining to your state. Thank you, Mark.
Thank you so much. I really appreciate this. And let me just offer this observation from the chat, which I share. Thank you, Angela and Roland, for sharing your organization's journey. To hear about your team's response to COVID-19 and beyond has been beneficial for other UIOs on this call and for us here at NCUI just to hear and understand. So I want to echo that thank you from our colleagues here at NCUI. Thank you again for this incredible session on challenges that you faced during the pandemic. And again, lots of UIOs have faced similar challenges. So we're glad that we had an opportunity to hear from them. And of course, we appreciate their input with speakers in the audience. I'd like to ask the audience to place the clap emoji or the heart emoji in the chat box to show their appreciation for today's presenters, Angela and Roland. Thank you so much.
Thank you again, NCUI leadership. Thank you.
Thank you.
I appreciate that. We have, thank you so much for your warm expressions. And again, a very informative session. There are a few minutes remaining for Q&A. I wanted to direct your attention to our raffle. We still have swag available. You can see a picture of our Democracy is Indigenous swag. We have not only the shirts and the mug available for those folks who do today's session evaluation, but remember, we also have that opportunity to be entered into a raffle for a free pass to the annual conference, No More Broken Promises, which will begin May 24th and May 25th. Thank you, everyone. Could we move to the next slide, please? Again, the upcoming events I'd like to share, we have on May 13th, this Friday, at 1 p.m., our Peer-to-Peer Solutions Center will host its office hours session. And I hope you'll be able to join us. We'll have a spotlight presentation from our UIO in Tucson. The Tucson Indian Center is presenting. So we're really pleased to have a UIO share the spotlight with us. Again, I want to thank you all for joining us. We have survey reminders. I think we've got the link to the survey has been placed into the chat box. I again want to share any feedback you have about today's session. And of course, thank you for joining us. If you go to the link immediately and complete that session survey, we genuinely appreciate your feedback. We invite you to follow the Qualtrics links then. Where again, our upcoming events, and I think we mentioned our May 13th session, the NCUI 2022 annual conference, May 24th and 25th. Registration is open for that. The No More Broken Promises, A Path to Health Equity in Indian Country is the theme that we'll have our conference under. So we hope you'll be able to join us for that important event as well. Thank you all again for joining us today. And again, a special thanks to Roland and Angela for this incredible information they were able to share with us. Thank you all for joining us for this important session. And we, again, hope you'll complete that session survey so we can hear back from you, hear about today's experience and any suggestions you might have for future experiences. With that said, I want to yield back the rest of your afternoon to you. We actually finished 5 minutes ahead of time. No one ever got mad at a presenter for finishing early. So I am really appreciative of everyone's attention. And again, heartfelt thanks. And I appreciate Angela and Roland's support with their expertise on this important topic. Thank you, everyone, and enjoy the rest of your afternoon or morning based on whatever time zone you happen to be joining us from. Thank you.
Thank you.
Thank you, everyone.